Hi world, like and sub. Thanks for watching and come along on a journey because this will be a journey. Pregnancy number 2. Here we go. As of today, I am 7 weeks pregnant. My symptoms are nausea, exhaustion, cravings. I've been wanting rice and gravy. I've been wanting steak and potato. I've been wanting like a lot of stuff like seafood. But when I get it in front of me, it's hard for me to eat it. I cannot wait to get out of this stage. I cannot wait to get out of the first trimester so I can enjoy my food and eat as much as I want. You feel me? Because them cravings be hitting. I'm like, ooh, I want this, I want that, I want this, I want that. But when I get it, I'm like, I have to make myself eat it. And I only can eat a small amount of it. That sucks. Sucks. But I am having mild cramping in my lower abdomen in my back. But it's not nothing like extreme. So I had my first ultrasound on Wednesday, and when I had my first ultrasound, I think I was 6 weeks and 4 days. And like I said, as of today, I am 7 weeks. So I got to see the baby. The baby is so small, like a little bean. I got to see the little heart flickering. I couldn't hear the sound, but I seen the flickering. And she said everything looked good. The heartbeat was strong. The baby looks good. So that's good, and that gave me a big relief, and I'm happy about that. So, oh, and another thing, I thought I was going to get a trans vag ultrasound like I did for my first pregnancy, because my first pregnancy, I think I was like 4 weeks when I found out that I was pregnant, and they did an ultrasound just to make sure, that I was, and I was like 4 weeks. They seen the yolk sac and a sac, but they couldn't see the baby, and they couldn't see no heartbeat nor hear a heartbeat. So they was saying like maybe, I had a miscarriage or something like that. They was like thinking the baby wasn't even there. But I had to wait for my regular doctor. When I made my appointment with my regular doctor, that's when I had another ultrasound. And by that time, I was like 5 or 7 weeks pregnant. And there was a baby there. There was a heartbeat. I don't think I heard it. I think my next doctor's appointment, I heard the heartbeat. But, so I think I was like so early on. That's why, they didn't see the baby. But like I said, I was expecting a trans vag ultrasound, but I got a normal ultrasound. And, like I said, we seen the baby, the heartbeat, the heart flickering, but we couldn't hear the sound. And she said that's going to come like a few weeks later, So I was happy just seeing that. And like I said, my symptoms are exhaustion, nausea, cravings, morning sickness, cramping in the lower abdomen and my lower back. And also bloatedness and gassy. Whew, I am so gassy and bloated. I go back to the doctor on next week, but it won't be my midwife. I seen my midwife. That's who I'm hoping to see throughout my whole pregnancy. But because of my age and my family history of high blood pressure and diabetes, my midwife had me seeing a regular OBGYN this week. And if all goes well with that, they're going to make sure my blood pressure is good and still not elevated. It was just like a tad bit elevated. It wasn't like nothing extreme. So then I also have to take a glucose test, which you normally take a glucose test about 20 weeks or so. So I have to take an early one, and then when 20 weeks or so or whenever come about, I have to do another one. So they just want to make sure, everything is good and that the baby is good. So then after next week, me seeing a regular OBGYN, I also have to see a maternal fetal medicine doctor. Basically, that's a high-risk pregnancy doctor. And they're going to take another scan of the baby and make sure everything's good. And if everything goes good with both doctors, the regular OBGYN and the high-risk pregnancy doctor, I could continue on seeing my midwife. And I'm praying that it's so, because I don't want no complications. My last pregnancy was good. I'm praying this pregnancy be good. I pray this baby be healthy. My last baby was healthy. My last labor and delivery was great. I'm praying the same with this one. So I'm just praying all is well. So y'all keep me in y'all prayers. Y'all keep my unborn child in y'all prayers. Y'all keep my pregnancy in y'all prayers in Jesus' name. And she only had me seeing a maternal, hold on, y'all always mess this up, a maternal medicine doctor, like I say, which is a high risk pregnancy doctor, only because of my age. Other than that, I would be seeing a regular doctor. So like I say, I'm just praying all goes well with both doctors, regular OBGYN and high risk pregnancy doctor. And I'm continuing on seeing my midwife like once a month. And I'm praying that this my blood pressure goes down and my glucose test comes back good and I'm good, you know. So that's about it. Like I say, I'm not gonna post a video next week with the regular OBGYN, but once I see the high risk pregnancy doctor on April 2nd, then I'll post to give y'all an update and let y'all know what's going on and if you're in my position, what to expect as well. So I'm gonna insert a belly shot. Like I say, I'm bloated, I'm gassy, so it's more bloat than anything. Cause like I say, the baby is teeny beeny. Like I'm claiming it. I'm claiming it. Boy, me. I want another boy. You know, I don't want a girl. I want another boy. So he is so teeny beeny, like a little bean or something, like so small. But like I say, I'm 7 weeks, so that's how it is, you know. So here the belly shot. Like I say, more bloatness than anything. Cause the baby, for real, when she did my my ultrasound, she was like down here. And where all this comes from? This bloatness and gas. No baby up here. So most likely I'm gonna show early because the second pregnancy and a little belly already. So yeah, that's about it. So once again, thanks for watching. Like, sub, and hit the bell notification button so you can come along and follow my journey and know when I post a video.